So this is where we keep some of our medicine supplies. This is just a baking cabinet, and on the bottom shelf we don't have any little kids aboard, so I'm not worried about anybody grabbing things they're not supposed to. This is all full of instant ice packs, which we throw in our bag to take to shore or trips or things like that, and it's just extras. So here in the top drawer we have things that pertain to wounds, scrapes, scratches, splinters, and things like that. Then the second drawer has all kinds of pills: ibuprofen, acetaminophen, a probiotic, because we did receive prescription antibiotics from our pediatrician and family doctor. And then on the bottom drawer we have our epinephrine injections, eczema relief cream. I bought a few of those because I've heard that people tend to have skin issues down in the tropics with all the humidity. So that's really our medicine cabinet that everybody can reach into and grab what they need. So here's the ditch bag, and it opens. And actually the first thing I have in there, you can see all of our remnants for breakfast, is this just mattress protector, I guess. I must have bought it when the kids were little. So I just kind of like to have something like that to throw on the ground or sand or table and just lay my supplies there. It's easy to grab and just throw in a wet bag and in a ditch bag, or just grab and jump in the dinghy or whatever. So this is what goes in our emergency bag as well as in our cabinet, so things are easily accessible if needed. I would go into our emergency bag and just grab things if we need them, and then refill them, so things are not just sitting in many places, you know, expiring. So this is more of a wound-oriented kit. We have normal saline, and then we have hydrogen peroxide, alcohol, and povidone iodine solution for wounds. And then I found that little thing for wound therapy, just an added something together with the you know, triple antibiotic cream that most people have. And then I bought these syringes, which are good. So this is a 60 milliliter syringe. It is good to clean wounds. So, you know, if there's an open wound, you really need to get everything out. So you need kind of pressure to wash it. So you just dip this in here and get some saline and squirt everywhere in the wound. And then depending on the size of the wound, we also have this small syringe. It's not, the small syringe didn't come sterile, but again, you know, we're cleaning a wound. There's probably all kinds of dirt and stuff in it, and then we'll worry about cleaning it really well after we've squirted everything out. Then we have gauze, various assortment of gauze. We have those little packets of burn cream, which again a lot of cruisers recommended, and I bought, it was available in a bigger package or a lot of small individual packages, so I decided to buy the small individual ones. Just again, on the boat everything is exposed to a lot of moisture, so I'd rather buy small things that are individually sealed rather than one big thing which will open and then it might expire or be spoiled faster. So this is our burn relief. Then we bought a bunch of Tegaderm, but they can be used over any wound that is you know, treated, and then there's probably a small bandage on it, and then the Tegaderm goes over it and it sticks to your skin. It's kind of like a second skin over your skin. It's really cool. And then we have these not adhesive pads, so these won't stick to your, it's like a gauze pad, but it's not gonna stick to your wound. We have a lot of alcohol prep pads. They're kind of small, but we have tons of them. They just come in bigger packages. So again, we have liquid you know, rubbing alcohol, but these are good to just put in your bag and have easily accessible for anything from cleaning your hands real quick to cleaning around the wound. Then we have an assortment of band-aids. It's kind of funny because I prepared all this kit of all kinds of medical supplies, and then I knew I was forgetting something. I wasn't sure what it is, and then it turns out it was band-aids, and that's the thing that we actually use the most. And then we have items. So in our emergency bag, all these things that you see over here actually fit into this Ziploc bag. And then we have another Ziploc bag which has items to treat wounds. So we have quick cloth and a little powder there in the tube that help prevent that helps stop bleeding. And then we have antibiotic ointments for wounds. Again, we do have a little tube of it, but we are using these individually packed ones. Are easy to store. Then we have the little strips to close a wound, small one. And then we found these really neat ones that help take out splinters, and we do get lots of splinters. So they're individually packed. It's just a little metal lancet that we actually, once we open one, we then sterilize it with some, or we clean it with some alcohol and then reuse it. Then I bought this disposable skin stapler. I was debating whether to buy stitch kit and have everybody try and stitch skin and then use it if needed, but anyway, we bought this, and so we'll see. And then we also have these closure strips, wound closure metal things, which makes sense to have, so we got some. We also have the SAM splint, reusable, cuttable, moldable. They're excellent. Hope we never have to use them. All right, so here's our selection of remedies against toothaches. And then I saw these. It's more of an essential oil kind of treatment against toothache, and it can be good against period cramps apparently, so we'll see. We do have somebody who tends to get earaches. One of the kids outgrew it, but the other one hasn't yet. So actually the first thing we go to immediately after coming out of the water, especially in a pool, it's a mixture of half alcohol and half vinegar, rubbing alcohol and half vinegar. This is our sun care. And more skincare. And then that's another one of those creams that was highly recommended and discussed on forums, that it's good for skin irritations, burns. And from skin ointments we move on to sting relief. Really our first go-to sting relief is just plain white distilled vinegar, and it works. We've tried it on jellyfish stings. It really does help a lot. This was just one of those things that I put in the cart and then wasn't sure when I received it if we really needed it. You know, when you kind of get into the zone of, oh, what if this happens? What if that happens? So now we have the extractor. All right, so seasickness. We tried those bands. You can buy them at any store, and they work on the acupressure principle. Then we found these relief band watches, and we've tried them, and they work great. And you don't have to wait until before you feel seasick. You can start feeling seasick and then put them on, and they will still work. So they have different settings, and it uses this conductivity gel. So you put a little bit of gel, and then you put the relief band on, and you tighten it, and then you push the setting. And the only thing with those watches is that if you are really seasick, you need to put it on a very high setting, and when they zap you on that high setting, it can be very uncomfortable. Your entire arm twitches a little bit, but then they do help. And then finally, something that I read that we haven't tried yet is this. These are just earplugs, and you plug 1 year only when you're seasick, and that apparently helps. Okay, and then this is just our kind of grab it and go to the beach little bag. It has you know, gauze, wound cleaning stuff.
They don't know.
Dry ice. They
That's why you're telling them.
probably do. All right, so we're gonna record this.